It's now my pleasure to introduce to you Peter Hustinx, the European Data Protection Supervisor. We are so delighted to have him. I just want to say a couple of words about what that job means. In Europe, as opposed to the United States, there are experts, government officials like Mr. Hustinx, whose job is to watch over the protection of citizens' data. Wow. So he is the top data protection supervisor for all of Europe. Every nation in Europe has a data protection supervisor. He was, of course, previously the data protection supervisor for the Netherlands, but many regions of many nations in Europe also have data protection supervisors. And so that scheme, many of you may not realize, came directly out of World War II. Came from World War II, because the ability to keep systematic records on who everyone was contributed to deaths. Now, we're not saying that, of course, health technology is going in that direction, but they're very, very sensitive about who can collect any data in Europe, and that's not widely known here. The reasons are they have a different history than we do, but their reasons are to protect individuals' autonomy and authority and really their identities. So, Peter, would you come up and talk with us? And I think you've read the title of his keynote. We're also going to make sure to have time for people to be able to ask questions. So please welcome Peter Hustinx.
Thank you.
Thank you.
Good morning, everybody. By now you must be awake. And Deborah, thank you very much for your very kind introduction. And it was not all that overstated, pretty correct. I'm grateful for the privilege of speaking before such a committed, well-informed, high-level audience. I'm grateful for the invitation, patients' rights, and I'm impressed by all the work the organization has been doing with its limited funds and resources, huge value, and this is being multiplied by events like this. I was pleased to accept the invitation, and I should tell you that it developed into a full week's program, because also in the course of today we'll be seeing various people who are working at privacy in government and private sector. But I'm so pleased to be here to kick off this event. I think we are seeing and living exciting times in terms of privacy issues. In fact, if you are a privacy professional, you have more than a full hand of activities. If you are a privacy advocate, there is a lot to be done. We see fascinating advances in technology, also some of it very worrying. We see, as a result, also increasing awareness. Some people are finally getting it, because they are carrying this with them every moment, every day, they're using, and some are starting to ask questions. So we now know that Scott McNeely's famous statement, "It's lost, get over it," is far from correct. We have to deal with this, and I'm pleased to say that sensitivity is increasing, not only in Europe, elsewhere in the world as well, including in North America, in Canada, and the United States. But we certainly have good reasons to also revisit the way in which we interact with this subject. Because if anything is clear, we also need much more effective safeguards. in such a dynamic environment. Maybe standard replies do not suffice anymore, if ever. So in my work in the European Union, together with national colleagues, whom we do not supervise, but work with, just for all correct understanding. So it's a network of supervisory authorities. Our focus is indeed now on making the current frameworks more effective. That applies to the highly sensitive information you are likely to find in the health sector, but it applies to health information outside of the health sector. And I think Patients' Right has made that point abundantly clear with stories. It applies actually generally. So we need to look at personal information as it moves online, offline. And therefore, the title of my remarks, it's time for a health check. And don't avoid going to the doctor to have a health check. So the legal system should face the facts, and we should see how we can do things better to make our legal frameworks and practices more performant. And I've noticed that the European Union is not doing this alone. The US is also reviewing its frameworks. That point was made by the Federal Trade Commission. And in fact, President Obama published a year ago a paper with some very strong language about the need to do better. Now, this morning, I would like to look back first at some of the big lines coming to us from history. Not any detail, then discuss with you briefly what we are doing in Europe, and then see how this all ties up together, and how we could perhaps build more of consistency globally, if I can be so ambitious. If we look in history, then it's very clear that US scholars, US judges, and US generally have played a very important role in developing the thinking around privacy and privacy protection. Say, the first theme was even the theme of sort of a negative, do not interfere, right to be let alone approach. And that term was coined in a famous article by Warren and Brandeis at the end of the 19th century. And they argued that it was just the next step the common law should be taking in view of the technology of the time, which was actually press and cameras only. But Brandeis came back to this idea in a famous dissent in a wiretapping case, in a alcohol case, a prohibition case, Olmsted, where he forcefully argued that indeed the next step to take was not just to limit this to physical space, but also to interact and protect under Fourth Amendment in the case of interception. Now that was not followed. It was a dissent. The case was overturned 40 years later. But what I want to mention to you is that the idea landed right after the Second World War in the United Nations Universal Declaration of Human Rights, prepared by a committee chaired by Eleanor Roosevelt. And the result was in 1948 that the right to protection against arbitrary interference in the right to privacy, home, correspondence, etc., the need to provide protection of the law was set out in that Universal Declaration. And the reference to arbitrary interference reminds me of unreasonable search and seizures. There is a clear link. Eleanor Roosevelt did a good job. It was a widely composed group of influential people who made it happen. And that idea of do not interfere, right to be let alone, was then a few years later also embedded in the European Convention on Human Rights, which was at the back of all our developments. And for certain, sure, there was a link with the Second World War, and human dignity was underlined strongly. Now there's another line which did not argue thou shalt not interfere, but approached it, say, from a positive end, the right to control the use of my information. And that was argued in a very influential book by Alan Weston, I should say the late Alan Weston, because he passed away in February, professor at Columbia, who studied in 1967 various developments impacting on privacy. And he coined the term that privacy is actually the claim, he didn't say the right, but the claim to decide whom to share data with, and then to decide on the further use of this information. Very strong emphasis. Now, I don't think that idea made it to your constitutional legacy, but some nations picked it up. And for instance, the German Constitutional Court in 1983 defined the right to informational self-determination, the autonomy of the individual to also decide on the information relevant for individual life. Now the court added immediately, and you can imagine, this doesn't go without exceptions. So in the end, it's a balancing test with some very demanding criteria, but the concept was still the right to determine. But this then develops into balancing tests. If we speak of balancing tests, it was again a very important United States contribution, but frankly it happened at the same time in the US and in Europe in the early 70s, but the fair information practices, fair information principles, this word was invented in and described and elaborated in a report of a committee of the then Department of Health, Education and Welfare. So HEW principles were designed to provide this balance of principles on collection, ensuring sufficient focus in use, purpose, individual participation, right to determine in a soft way, access and correction, and these principles and responsibility, and also some soft principles on oversight. These principles, which were also developed in Council of Europe resolutions in the early 70s, made it, for instance, to the US Privacy Act, which reacted to Watergate. This was a big incident, to say the least, speaking of incidents. It was a major event, and the reaction was the US Privacy Act. It hasn't been such a lively thing since. It then also was further elaborated in an important set of reports of the US Privacy Protection Study Commission, which published, indeed, it was volumes like this in 1977. But then perhaps energy was gone. And in the era, Reagan era, the energy to put all this into legal infrastructure and into policy faded away. But it fed into the OECD guidelines, which were adopted for all OECD member states in 1980. It was also integrated in a Council of Europe convention, 1981, which has now 44 European member states ratifying it. It's a legally binding convention based on the very same FIPS which were developed in the HEW report. I said European nations. Quite recently, Uruguay joined that convention, and it is likely to be followed by other Latin American countries. So, in terms of how these ideas developed, I think you have left your fingerprints, your footprints, your DNA in the thinking which is now developing worldwide. Could I add a little personal note? Because when I came to the United States as a young law student, graduated in the Netherlands and preparing for a year of study at an University of Michigan Law School, I then met Arthur Miller, who had just completed his book, Assault on Privacy. It had not been published yet, but he gave a sort of seminar on the book he had just written, and it was a fascinating experience. It resulted, you see that in the land of the blind, the one-eyed is king. The expression is in the Netherlands. I hope you get what I mean to say. So it put me on a course of being a secretary of a royal commission developing this. And when I met then, in 1976, the secretary of the US Privacy Study Commission, Ronald Plesser, we were comparing notes. And he told me, gosh, in the US you'd need a stronger rationale to do what you guys are going to do in Europe. And that gave me a very early signal of how perhaps our societies are similar but also different. Now the follow-up to this is also interesting. In Europe, as you can imagine, this convention of the Council of Europe was transposed into national law. All member states started at various points in time to develop this into their national law. The convention was rather general, so national law was far from identical. And it led to the need to ensure a greater consistency. So the European Union joined on economic reasons, because they wanted the internal market to work better. But this then led to a directive in the 90s, 95, which set very precise criteria. This directive is currently being revised. That is the famous review of EU data protection framework. But the Council of Europe and the OECD are also revisiting their frameworks. So this is producing a very powerful synergy. And guess what? The conclusions go in the same direction. We need to make our principles more practical, more impactful. We need to organize our data management better. We need to organize accountability better. It's not pushing back because the New Times are saying principles get out of the way. It's old-fashioned. No, these principles are still valid. They are probably going to be confirmed, all of them, tweaked at the edges perhaps, to take account of all the dynamics. In the European Union, let me add that, for instance, the case law of the European Court of Human Rights, there's a court in this Convention on Human Rights, has stated in a number of cases that particularly in the health sector, medical data, the protection of these data is actually an essential element of the right to privacy. There's a technical detail. This Convention of the Council of Europe is not self-executing. It needs to be transposed, but the court says, if you ignore this, we consider this as a breach of the right to privacy per se. And there have been cases where hospitals have been found liable for not providing sufficient protection to the medical information they were in charge of. But gradually, the rationale of European-wide rules moved from internal market considerations to sheer human rights, civil rights, fundamental rights. It's your terms, you want, but have now been laid down in a Charter of Fundamental Rights for the European Union as such, which was made a binding document just a few years ago, in 2009, and applies now to all the member states, the right to privacy and the right to the protection of personal data, period. And it has also included in the treaties a new general legal base to provide rules both at national and EU level in all policy areas. And this has certainly dynamized the environment. The Charter sets out the right as such. It sets out the essential principles, which go back to the FIPS. And it also sets out the need for institutional oversight as part of the need for checks and balances in the public sector and the private sector. Safeguards are necessary, and the role of institutions like mine is to make sure that this is respected. Now, in the US, the history was a little different. You have followed a path of sector-specific protection, sometimes strong, sometimes weaker, but of course with the problem of a patchwork ending up. I'm aware of all the activity, also state. I know the sensitivities, federal, state, and I'm aware of the HIPAA and also of its deficiencies. But to fill the gaps, then your government has been encouraging self-regulation. Some of it successful, some of it frankly not so successful. We've been negotiating how to bridge the gap between EU and US, because data need to flow and protections need to apply seamlessly. This led to the US Safe Harbor Agreement. And gradually it had some success and growing, and I think it's wonderful to see that the Federal Trade Commission is increasingly engaged. And I was very pleased to read the Obama paper in March last year. And one of my messages these days is I would like to see the promises of the paper delivered in law or practice. And I'm not going to lecture anybody, but if this would be done, it would be such a great contribution to greater consistency of protection. It would allow data to flow more freely, and therefore I think it is worth the effort. And I hope to hear Obama, by the way, the paper spoke about revitalizing the FIPS. And so, you guys, this was something you as a society developed, and it's grateful to see. My perspective is that we should increase the synergy. Let me go quickly to what we're doing now. In the European Union, and so much you have understood, there is a current framework which has developed in 40 years' time. This is not just an invention of the 90s. And Mark Rothenberg, by the way, wrote a very interesting article recently in the Harvard Journal of Law and Public Policy, where he argues that this has indeed a big history and it has a very relevant context. Now, why this review now? The reason is rather obvious. First reason is we need to make this much more effective. If you adopt rules in '95, the internet barely existed. Mark Zuckerberg, I don't know where he was. Larry Page, I don't know where he was. Certainly not in Harvard yet. So we need to integrate this and face the challenges of technology and globalization. So that's one. The second is the directive is an instrument to bring national law closer, but it's not a model law. And now we've ended up with 27, soon 28 national versions of the same. And if you deal with this in a world which is increasingly dynamic and global, it's kind of a problem. So we need to reduce diversity, ensure consistency. And the third reason was that this treaty, the recent emphasis on fundamental rights and horizontal protection, needs to be translated in all policy areas, including, for instance, law enforcement, and that's what is currently happening. Now, the European Commission has put a proposal on the table a year and a half ago, very substantial package of proposals. I'm not going to do any detail. That's not interesting for today. But the most prominent part of the whole package is the idea to replace the directive, which is a two-step instrument, as you can imagine, by a regulation which is to be directly applicable in all member states, all those 27, soon 28 member states, which is to replace large parts of national law. Well, that's not a small thing to propose. You have your discussions about the beauties or the negatives of federal preemption, but here we are talking about 27 sovereign states. So the discussion in Brussels currently is how this regulation should be fine-tuned to make this work. In spite of all the innovations in this proposal, there is also a very big continuity. All the basic principles and concepts come back, sometimes slightly redefined, but you'll recognize them all. There is also a strong emphasis on the rights of the data subject. The right to control, to decide, has been enhanced. In this world, you cannot be the only one deciding, but there are situations where you can decide, or where you can say, I disagree. And then you should be able to at least get due process, and sometimes you will have the monopoly, because then it doesn't happen. So, and this is the context in which the right to delete and erasure has been formulated as the right to be forgotten. That is a bit of an overstatement, but it's very welcome emphasis on organizing deletion, organizing timelines. There's also an emphasis on stronger consent. Consent sometimes more than sometimes, is an element in the whole framework, but when you need consent, the proposal is it should be specific, express, clear, informed. It should be robust consent, not wishy-washy things like, you've been notified, you didn't object, we think you agreed. And there's a lot of that on the internet, and because our procedures are so complicated. Could you please sign here? Could you please sign this? And so forth. Nobody reads this. So are we actually building on consent then? Or are we actually avoiding explanations why we think, the organizers think, it's just legitimate? So you need to strengthen the rights of the data subject, but also need to enhance the responsibility of controllers. And that's the second element, more accountability. Responsibility in our current framework is somewhat of a definitional notion. Who is responsible? The controller, technical term, the business, the government agency. And it is a notion at the end. If something goes wrong, who's liable? But the proposal makes it an activity. If you are responsible, you should be doing something. You should be organizing things. You make all these measures necessary to ensure compliance. You need to check whether it's still effective, and you need to have evidence that you have done all this. So accountability is an agenda. It's actually a comprehensive privacy program. Oh, that's very welcome. Because if we wait for the breaches to happen, they happen. And they will sure happen if you wait for them. We cannot probably avoid them all. But if you build privacy by design in, and you organize it better, it surely will be a lot less. There is in our system also scope for much stronger supervision. That is, in all these member states, the same standards of independence, the same strong powers. The proposal provides for very strong fines. 2% worldwide turnover. For some companies with big activities around the world, that's a lot of money. And so this has also incentivized everyone to get engaged. Is this relevant for us? Yes, it may impact on us. So we have a very hot debate at present. And some of your organizations and companies are certainly not silent around the table. But I think it's important to make sure that we allocate the incentives for compliance well. As this is a regulation, and not in the reg sense of your term, but this is primary law, all applying, and then identical in all member states, there is a huge emphasis on consistency. But there's also a mechanism to make sure that these independent regulators sitting together also jointly provide more consistency. So there will be a huge step forward also for companies who are doing business in France, all over the EU, that in Finland and Portugal and Ireland and Greece, it will be the same answer. If they're still independent, that seems like a challenge. But it's happening. I think it's working. There is also a redefinition of the scope of European law. Now these standards apply in the context of activities of an establishment in the European Union. A bit obvious. But also when data move to other countries in the world from an establishment in Europe. So if data move in the cloud to, or outsourced to India, if this is a European operator, European rules would apply. The proposal adds a second leg. Also, when this happens from elsewhere, and this is in the context of offering goods and services on the European market, European laws would also apply. So there is a very strong nexus with the European Union itself, either because it happens in the EU or from the EU, or it is targeted on the EU. Now, also that leads to some discussion, obviously, as you can imagine. There is some further work in the context of trans-border data flows, principles of adequacy, and if it does not exist in terms of law or practice, how this could be provided ad hoc so that safeguards are built into transactions sufficiently case by case. If we see this happening, I think we'll see both continuity and much more effectiveness. But I don't want to go too deep in what we are discussing. It's not done yet. Parliament and Council are working on this, but I'm quite hopeful that this will happen soon. And then my perspective is this is a contribution to the needed consistency across the globe. My perspective is that we should, in doing so, work towards interoperability, a key term in the Obama paper. I think it's deliverable, it's possible, it's desirable, not next year Christmas or this year Christmas, but say let's 5 years from now we should be well on our way in delivering it together. But provided, of course, that the Obama paper is put into practice, is delivered, and I know the challenges. I'll be seeing some people on the Hill today, and I know how difficult sometimes things are. But I thoroughly wish you all that this will happen. In our case, the target is to deliver the results by spring 2014. I have referred softly to the US government and business and engaged in the discussions in Brussels. Some of it was a bit overstated and excessive, but you should not complain about lobbying. But the full court press approach doesn't work in Brussels. So some of it is also firing back. Where are we together in the health sector? I don't want to comment on some of the problems which have been exposed by Deborah and her organization. But my experience tells me that if you draw lines, you have also imbalances. And making things effective in a more balanced and consistent way is very much necessary. We'll have also very soon perhaps an occasion to talk US, EU in other contexts. This is now transatlantic trade negotiations developing very soon. My view is that we cannot avoid discussing this, but it is wise to set a timeline by which we can work towards interoperability And bringing this very complicated subject with all its repercussions in trade agreements will not deliver any solutions. I will get excited, so we should not do it in this way. But I very much wish you a very productive day or two. I'm sorry I will not be able to attend most of your procedures today, but you should be aware that I'm trying to push the right thing forward at the very moment that you're discussing it. And I wish you all the best, Deborah's organization, and I'll bring the best greetings of you back to my colleagues, and I'll make sure they will note what you have done. Thank you.
Thank you. Well, I can imagine that there are many people with questions for Peter. Please come to the microphones. You can identify yourself if you like. No? Oh, yes. I guess we don't, can we get some help people with microphones?
There is a microphone
okay.
there. There's a microphone there.
Oh, I'm sorry. Yes.
She was first.
I don't think it's working. Oh, dear.
No, it is a little. I can hear a little.
It is? Okay.
You need to eat it, then it works.
My name is Chris Allman. Thank you so much for your perspective. I'm very curious as you brought up the transatlantic negotiations in light of what is happening with the Trans-Pacific Partnership and whatever global trade agreements that are secretly being put forward. You have brought up safe harbor. You've talked about the issues of trade and how this is all impacted and how your belief is that your protection should follow should there be the cloud outsourced to America or otherwise. And then we have the Patriot Act and all this business. So to what degree are you worried about whatever's happening with the TPP negotiations and however that may make it that much more difficult for Europe to have their stringencies and what we can do to advocate fully for disclosure on what they're doing with the negotiations?
Yeah. First, what we believe the review will deliver is an updated, much more effective set of safeguards, but also a lot of continuity. And I believe that for instance, the redefinition of scope is very appropriate, but it will have some impact, of course. Then, should this be part of trade agreements, trade negotiations, sorry? I think that will not be possible, but of course some relevant subjects could very much be part of the discussion. And there are plenty. I mean, I'm not saying you should not talk about the internet and how the online environment and service, that's probably all relevant, and there are huge interest to discuss this. But the expectation should, in my view, not be from no side that it would be a good idea to provide any fine detail on what consistent data protection cross-Atlantic should be, or any provision saying, oh, this is not going to apply. That's a total non-starter, in my view. In that sense, I applaud, and we've heard that some NGOs are arguing it should not be part of the negotiations at all. Am I concerned? That's not the right terminology. But of course, if things go wrong, it would be a disaster, obviously. This will not happen. Interoperability is the key word both sides agree on. And this is, if you speak about electric appliances, and even about, say, PCs and software. Interoperability is difficult enough, but if you speak about legal systems, making them interoperable, that really takes a bit more effort and analysis than we can do in a short time. So if this is desirable over time, maybe we should agree on a calendar and say, so let both sides, EU, US in this case, do their reviews, do their best effort, and let's ensure that they move in the right direction. And let's then see whether we need to revisit anything special. That would be, I think, a much more smart solution than drawing this into negotiations on trade. This is the actually non-trade issue, but it has some trade repercussions. So I'm not ignoring the interfaces. Huh? But I hope you get my soft signals clear enough. Yes.
Hello, my name is Marty Escabel. I'm the privacy officer at Children's Hospital Colorado, and I'm also in the Information Security Department. And the reason I mention that is one of our frustrations is with policymakers who are making policy or privacy determinations without the realization of the technological impacts. And for instance, encryption right now is very difficult to do well in hospitals, and because of that, people won't use it, which defeats the whole purpose. And so given that, can you comment how you're trying to bridge the gap between what you're doing on the privacy side with the technological implications or limitations of what technology really can do, or what you're asking it to do?
The answer has various elements, but first is I don't think that lawyers around a table will be able to solve this. Huh? But by the way, technicians around the table will not be able to solve it either. But the point is, you need to do this together, and you need to make sure that technical considerations and norms and ethics and so forth are part of every relevant project from the start. And that's why privacy by design is such a powerful concept. Now, there's not a book on privacy by design which you, like a cookbook, you can follow step by step and then you have a wonderful dish. No. But there are quite a few cases where, for instance, Anne Cavoukian in Canada, in Ontario, has demonstrated that the real value, and this was so convincing that this is in fact, one of the examples of common territory. Again, the WAMA paper and the Department of Commerce documents and the Federal Trade Commission all emphasize privacy by design. Now, this means that this is not a subject of doing your product, doing your thing, and then, 11:45, midnight, just legal needs to get some signatures right. No. Then you're certainly going to blow it. This is also why regulators in Europe now more and more have their own technology departments internally. So we include thinking about feasibility, desirability in everything we do. Part of my role is to advise the Commission on its proposals in the digital agenda, which is code for a lot of stuff along these lines. E-health, e-transport, e-security, all those E's, e-commerce, are full of things which actually all make the same point. Yes, I would say, therefore, be inclusive, privacy by design from the very start. And finally, the review we do does not precisely prescribe, again, it's not the cookbook, exactly. It is the methodology, and the incentives are very strong so that it happens. And the onus is on the organization. So could you please explain to me whether you have done privacy by design? Is there records of what you've done? How come this leads to this big problem? You may not have done this? Ooh, shame on you. So that's the big incentives, and regulators will be helping with guidance, but The responsibility is, in the case of the health sector, I think, at the health organizations, also insurance companies, and all those who are using those data. And I think they should be held to account. And this is why, yeah, I agree with the idea that it would be wonderful to have more comprehensive, more general, not perhaps all that detailed, but some of the essential elements should be as horizontal as possible. And this is not all expressed yet in the Obama paper, so there is perhaps something more to be done.
Hello, Peter. My name is Kurt Long. I'm with the company called Fair Warning. As usual, we put on a great event. Thanks for hosting it today. First, a comment, and that is that thanks for sharing your human rights perspective with regard to that as a basic civil right, and that's something that U.S. legislatures and all of us in the room can learn from. I think you put forth a compelling vision for more standard privacy and security standards throughout the world that will grow our economies and even lead to fairer economies. And then I have a two-part question for you that's very tactical and specific, and that is, having been through the evolution of privacy within healthcare in the States, what we've seen is that patient notification, kind of a populist or democratic right for a patient to know when their data has been breached, has been a very empowering portion of the legislation that we've passed successfully and then enforced successfully. And I'm wondering at the tactical level, but with that said, a very empowering tactical level, how close is the EU regulation that's pending being contemplated? How close are we to seeing healthcare as at least an included industry, not necessarily named specifically, but at least an included industry that gives the individuals a right to know their data has been breached? First part. Second part is, if there is such pending legislation being contemplated and you think it might be passed, what's the reasonable time frame that it would be enforced and implemented on a country-by-country basis throughout the EU? So that's
Okay.
a two-part question. Thanks again.
Yeah. The security breach notification is another example of something which was invented in the United States. I'm not sure which state was first, but my guess is California.
It was.
And
It was.
well, and many others followed. And that was also an important learning curve, because diversity and so forth and so on. The review of the EU framework includes provisions on security breach notification. It includes, and that applies to also to health care. We already have this quite recently for the telecom industry, but that's a directive and it needs to be transposed into national law, so there is only recent experience. But as this is in the regulation, I think it will stay there, it will be adopted, and if this is indeed delivered by spring 2014, it is likely to be fully in force 2 years later. It does not need to be translated into national law. This will be just the law of the land in all those 27 or 28 countries. But some of those provisions probably need to phase in for obvious practical reasons. But so this is fairly close. Now let me add the point that there's also the risk of what you call notice fatigue. Oh, again, another notice. So it's important not to overdo it. In general, in terms of notices, that it's more important to have the essentials and then references to easy available information on details rather than long things. No one in this room, and you're all engaged, takes the time to scroll and crawl and crawl and read all those 37 articles. And then somewhere is a disclaimer which you haven't noticed. That's not the right approach. And in terms of that's, of course, not the same as a security breach notification, but if we have too many things which are just unhelpful, it's not good. So there's a question of in which serious cases. So there's perhaps a sense that more notifications to the regulator only when there is significant impact or to patients, data subjects involved, etc. But all the elements are there, and we're also learning from your experience. Yeah.
The U.S. has embarked on this NSTIC process. It is a public-private partnership, mostly private, designed to deal with identities in cyberspace. There are obviously huge privacy implications. You talked about two things that are relevant here. One of them is interoperability of our systems across Europe. Another one is the sectoral nature, the difference by sector in this country as to privacy policies, laws, whatever, versus in Europe. Do you have any, and obviously for healthcare this is very important because in the NSTIC process, one of the key things is to have it be cross-sector, as you mentioned, for those who haven't followed it. In other words, to have the convenience and the security of one's identity carried over from the banking sector, let's say, to the healthcare sector, or the passport sector to the healthcare sector.
Yeah.
Is there a European equivalent?
Not as, say, comprehensive as the one you describe. Of course, it's a vision, it's not been delivered yet. But also because identification and e-identification is currently a matter of member states. So there are substantial differences. The European Commission is developing bits and pieces to bring this closer together, but there is no general infrastructure yet by which this could work. In the e-health sector, the perspective is building an infrastructure so that patients across national borders could be helped in a consistent way. In terms of cybersecurity, and you referred to that as well, we will be seeing the latest proposals very soon, and I will be asked to react to the proposals. I can't tell you what they are now because I simply don't know, but there might be a connection there as well. But that is pretty complicated. E-signatures are things, authentication infrastructures, that's on the table, but it's less developed, comprehensive in Europe. And so I have to pass, actually.
Maybe that's an area we can work on with you
Yes,
at some point.
yes.
One last question really quickly, then we'll have a 5-minute break before the next panel. Let people move around a little.
Good morning. My name is Helen Hollins, and I serve as a privacy officer for one of the government hospitals. And of course, we are utilizing HIPAA regulations, and you noted there were HIPAA deficiencies. I would like to know, what do you see as something that should be changed? What would you change?
I'd love to give you my list of things to be changed, but actually, courtesy requires that I stay distant from the details here. I'm aware that I know from my briefings and previous readings that not all HIPAA elements were promised, as promised, were delivered in practice. Certainly not as to where consent came in, and things have changed. But and so, but it would be unwise for me to go into any further details. I hope you can accept that.
Okay, thank you.
A very diplomatic answer, a wonderful talk, and I hope you'll join me in thanking Peter for spending time with us.